the occasion of the launch of the first webinar dedicated to the training of healthcare providers in the care of patients suffering from atopic dermatitis, let me introduce Dr. Pierre, Professor of Dermatology and Pediatrics at Northwestern University of Chicago, and Professor Stalder, Emeritus Professor at the University of Nantes in France. So, Professor Stalder, maybe could you please introduce the problem in a few words?
Yes. Atopic eczema is the most common chronic disease in children, affecting between 10 to 20% of children and 1 to 4% of adults worldwide. This inflammatory dermatosis is constantly associated with itching and also sleep disturbances, which sometimes seriously disrupt the quality of life of patients and their parents. Despite effective treatments and a consensus among experts about the management of the disease, the patient satisfaction is poor. Why? Firstly, because the disease evolves in an unpredictable chronic way, and patients are their own therapists and must acquire knowledge and skills to apply the right treatment at the right place at the right time. Moreover, a common complaint among AD patients is that the time allocated to standard consultation does not allow to truly understand the answer to their question. And when the patient returns home, the practical application of care procedure can be daunting for them. Finally, the mass of information given by caregivers, expressed by patients and their families, widely disseminated on social network, confuse patients, promotes anxiety, and increase the burden of this chronic debilitating dermatosis.
And today, how do the guidelines integrate this low satisfaction with care?
Today, recent guidelines for the treatment of atopic dermatitis in adults and children recommend therapeutic patients education as a basic therapy for every case, mild, moderate, or severe. Indeed, the most effective way to manage atopic patients is to provide time for education and time for demonstration of a comprehensive range of treatments. TPE is designed to train patients in the skills of self-management or adapting treatment to their particular chronic disease. They help the patients to cope more effectively with their illness. Several healthcare professionals can be involved in TPE, in addition to dermatologists, allergologists, pediatricians, pharmacists, nurses, psychologists, and dietitians can be involved.
Maybe could you tell us a little bit more about the POP training adventure and how the project was designed?
POP training was an adventure because regarding this pathology and the problem of this pathology, the decision to create a teaching dedicated to pharmacists was decided jointly by the French group of therapeutic education and the Eczema Foundation. The Pierre Fabre Eczema Foundation is a corporate foundation that was created 20 years ago to support patients and caregivers in the optimal management of eczema by helping to design, finance, and carry out projects for patients and caregivers. The Eczema Foundation participates in research and support a joint initiative providing tool, brochure, a video clip, a social network connections, and so on. You will be able to discover its contents in a dedicated website, and I advise you to visit it at the Pierre Fabre eczemafoundation.org. This website is translated in 6 languages.
And how was the project designed?
the project was launched the first time 4 years ago, which stands for Patient Optimization Pathway, was designed to meet the care needs of patients suffering from atopic eczema. Initially dedicated to pharmacists, this training received the participation of nearly 1,700 caregivers in France. POP training was also offered in Algeria, where more than 200 pharmacists took part in a one-day training session.
And why did you decide to target the pharmacists?
We decided to target the pharmacist because the pharmacist is the key figure in a patient care pathway. Surveys of pharmacists show that 95 of them take care of atopic patients, but only 65 of them say they are insufficiently informed, in particular the cause, complications, symptoms, and management of eczema.
Could you also tell us who were the caregivers concerned?
At the beginning, POP training was initially a complete training of 6 modules, illustrating the concrete situation faced by the caregiver and atopic patients. And this presentation was made not only by physicians, but also by nurses, psychologists. But finally, the e-learning program, named in French Parcours Officinal du Patient, was designed by 6 French different reference centers. This content was validated through the by consensus by the French group on therapeutic education and the French Society of Dermatology. POP training was a complete training illustrating the concrete situations which with the caregivers and the atopic patients are confronted. The training was possible in different forms, face-to-face, remotely online, or in replay. And finally, the majority choose the replay formula, more adaptable to the availability of learner. POP training was an attractive course made up short presentation, illustrated with numerous video, testimonial, counter cases, far from theoretical lessons. And at the end of each module, educational tools were offered to complete and test the skills. In conclusion, the webinar facilitated the transfer of skills and knowledge via tools shared by patients.
Thank you. So today the project will be launched in the US. Could you please, Professor Stalder, maybe introduce this US project before giving the floor to Professor Liu?
I'm especially happy to know that this project will be developed in the US because first of all, we are very good friends and we worked a lot all together. And finally, we know that this alongside the new treatment, the revolutionary treatment, we need also to improve the compliance of treatment. And I think that is one of our goals to do that. And I think for the first time, we could offer this webinar not only to pharmacists, but also to other practitioners, with nurses, practitioners, physician assistants, and that is a good opportunity.
Professor Leo, maybe you could add something else on why do we want to launch this program in the US?
Yes, we feel that this is such an important aspect to focus on because we know that some problems that we have are not just a matter of a new treatment or a new technology, that sometimes the pieces of the puzzle are there and we just need everybody to be involved and understand how they all fit together to get that optimization for patients. And we realize that Pharmacists play a huge role in the US as well. And so do things like, of course, nurse practitioners and physician assistants. These advanced practitioner type roles are extremely important and frankly, getting more and more important. So many patients deal almost exclusively with those providers that we can't neglect them. So we want everyone to come together as a team, and we're really trying to put together all of the learnings from France to bring that to the United States and hopefully continue this growth, because this is a worldwide problem and it doesn't just stop here.
What are the main differences between the French and the US program?
Differences, but I'm happy to say that it's heavily influenced and inspired by the original program from France. Some of the differences include our healthcare systems are a little bit different, so we've tried to tailor it to fit in the United States and have up-to-the-date information that's really designed for practitioners in the United States. The other piece is that expansion into not just pharmacists, but also to the advanced practice providers like nurse practitioners and physician assistants, because they play such an important role here in the US.
And what impact do you think it will have? What do you expect from this US program?
Definitely hope that it's going to have a huge impact. And I think that part of what will happen is that we can see what I call this therapeutic alignment, where the pharmacists, the primary care doctors, other specialists, the patients, all of us are working towards a common goal. And I think when that happens, if everybody understands what those goals are and understands the tools to get us there, I think that the patients are so much more likely to have better outcomes, because that's really why we're here. We're trying to help our patients better. And amazingly, to do so with fewer resources, because we're not asking for more money. We're not asking for more time. We're not asking for new drugs here. We want those things always, of course. There's never going to be enough of new treatments and new approaches. But here, we're just saying if we can all align ourselves and work together just with the things we already have, we think we can help people more than ever before.
Is there one last thing you want to add on the project? Maybe one word to conclude?
Been such an exciting project to think about this global problem. And it's so wonderful that we get an opportunity to work with our partners across the world to solve these problems. To me, this is the highest art. This is what we're really here to do. We work together, we're trying to help people. And by putting ourselves in alignment, hopefully we'll bring everyone in alignment with us with, again, the goal of getting people better. Thank you so much for this opportunity.